across the country, marches were held on Thursday in recognition of the 2-month anniversary of the Occupy movement, which continues to gain momentum despite clashes with police. More events are planned for this weekend. In San Francisco's financial district, Occupy protesters stormed a Bank of America branch Wednesday, leading to nearly 100 arrests. And Mayor Ed Lee called for dramatic changes at the encampment there, which was declared a public health nuisance. Also this week, thousands of students and faculty participated in the Occupy Cal general strike at campuses throughout the state. UC Berkeley demonstrators were joined by members of Occupy Oakland. The campers in Oakland had been evicted earlier in the week under orders from Mayor Jean Quan. So, Nanette, Asimov, UC had been pretty quiet on the Occupy movement until this week. What happened?
That's right. It was about a week and a half ago that they just caught fire because the Occupy movement just seems tailor-made for student anger over rising tuition and high executive compensation. It's perfect for them because there's a ready-made 99%. There's a 1% of leadership that control the purse strings. And in the past, the regents at the University of California and the California State University trustees had strongly tried to direct student anger to Sacramento. You know, get with the legislatures. They control the purse strings. But now the Occupy movement has said, you know, go to the people who are on the bank boards, go to the people who have the money. And the students are all too happy to look at which regents are on boards of banks and say, do something for us. It's your fault. You have the power. And so this has really energized the campuses, and they're setting up the tents, and unfortunately they're also being batoned by police because universities don't want the encampments on their campuses.
And what's been the response from the regents? Have any of them said, oh yes, I'll go to my Bank of America board meeting and, and make these demands for you?
Well, one of the things that the occupiers are doing is asking individual regions to please sign a pledge that they will rescind the tuition increases, that they will stand against Prop 13 tax loopholes for commercial businesses. And that's what the occupiers want. Not one regent, not one trustee of the California State University has done so.
Well, this week there were more fee hikes.
There were. The CSU trustees raised tuition 9%, and that was on top of 12.5% earlier this summer. And in all, I think for both university systems, the price of an undergraduate year is 3 times what it was just 10 years ago. And at the same time, executive compensation has increased because new executives come in and they get higher packages. There was one that got $100,000 more than the predecessor at San Diego State. And so students are, I think, calling this a tax. You know, it's the Republicans in the legislature that say we won't raise taxes, but the students are saying, what do you think this is? You are raising taxes on us by raising tuition.
Nanette, I'm just wondering, my vantage point in Sacramento, watching, of course, as you said, they usually tell people to come here and complain about it. Did you get the sense at all that, like, the trustees at Cal State, for example, were caught a little flat-footed this week? I mean, are the people hoarding into the room, and now they did it in closed doors, and now Gavin Newsom saying, exactly, vote again on the tuition hike? Were they somewhat flat-footed by the reaction from this crowd? I
think that they knew that there would be something. They knew that there would be some sort of protest there, but they didn't know how violent it was going to get. And when the student protesters and a group called Refund California stood up and made these demands, you know, rescind the tuition and all of that, they were escorted from the room. And I was listening in, and I thought that Chairman Herb Carter was trying to be polite. He was perhaps a little more tolerant than the regents often are with these things. And so, but at one point, the police did have to escort them out. And at that point, they clashed just 10 feet from the boardroom, and a plate glass window shattered, and police, one guy was sent to the hospital, and there were tear gas. And so what the trustees did was they just moved to another room and kept up their business. And now Gavin Newsom, who is a trustee, is saying, look, you can't conduct your business out of the range of the public view. There were no press there because they were all with the occupiers. So they were caught flat-footed. They thought they were going with the law, and Chancellor Reed has now told Gavin Newsom, we're not changing our vote. This was done, and so that's what we did. That's what the
fees are now like about $6,000 at some of the state universities. Is that about right?
But at UC, they're over $13,000. This is basic tuition and mandatory fees. So it's over $13,000. And students, I think it's 2/3 of students across the country have debt that they can't afford. They graduate on average with $25,000 in debt. So students are saying we just can't afford this. And wasn't education supposed to be free in California? And as a matter of fact, it was.
Well, more demonstrations expected this weekend, some of them coming from cities like Oakland and San Francisco, I suppose. Are students involved in this
well, students
next step?
Are. They're just regrouping. And the next at UC is planned is a Occupy at Sproul Plaza at UC Berkeley on Monday night. I think they're going to have a sleep-in. But I have to just tell you how creative the students are getting. They floated their tents because they were told no tents on campus, so they floated them in balloons. So they'll come up with something new.
Well, a march in Oakland, I know, and one on this action on Monday, so it continues to grow. Mostly growing at the root of all of it, at least for the universities, John Myers, is the fact that there's no money. The legislative analysts have also said that maybe some other dire cuts might have to come along because of a shortage of taxes. Is that right?
Yeah, we got word this week, Belva. We've been waiting for two different sets of economic forecasts about the state and the state budget and the budget that was signed into law back in the summertime. And the first one we got this week, right, from legislative analyst Mac Taylor, that says the state is going to miss its revenue projections by almost $4 billion, which just coincidentally happens to be the amount of money that miraculously was added to the revenue estimates to balance the budget back in June. But if that happens, we've got these cuts, these trigger cuts that do include more cuts to higher ed, another $100 million to UC, another $100 million to CSU, social services cuts, and also very controversial, if we miss the revenue projections by that much, about $1.5 billion cut from K through 12 schools and community colleges. That's going to felt ripples all across the state. Of course, we haven't had the full set of revenue projections yet. Governor Brown's team is going to weigh in December. But the bottom line here is that that budget that was crafted is obviously way too optimistic, is kind of what we're hearing here. And I think people who have had all these cuts all these months before are going to be subjected to a lot more of them, absent any discussion of taxes.
What about the K-12 situation? I get confused between Prop 98 money that was supposed to protect them and the reality that we live in.
Well, the reality of Proposition 98 is it's only a protection for school funding as long as the tax revenues materialize. Prop 98 is written in such a way, and it's one of the most confusing parts of the state constitution that the voters put in there. It's written in a way that if the revenues go down, it's only guaranteed, the schools are only guaranteed a portion of the revenues that exist. So when we're sitting here talking about the forecasting showing that revenues will be about $4 billion lower than projected, that automatically lowers the amount guaranteed for the schools. The really interesting part about K through 12 schools in this process is going to be that people are saying, well, you could shorten the school year by 5, 6, 7 days. Well, that may or may not be possible. One, we've already started the school year, and two, the way the budget was written is the only way to shorten the school year is through negotiations with the teachers' unions. And as one education lobbyist told me this week, how are you going to get them to want to sit down and shorten the school year, shorten their own paychecks? They're going to want some other concessions. The schools may be stuck, and some of the schools may be defiant. I think you saw that in higher ed. You may see it at the K through 12 level of schools in California saying, we're not going to do it. You know, what are you going to do to us? We're already in the middle of the school year.
John, we saw this week with the cuts to the adult day health care centers that had gone through last year. This was $85 million that was essentially going to dismantle the adult day healthcare network in California. We had a lawsuit in federal court filed on behalf of disabled Californians, essentially arguing that this put them at risk. And just yesterday, in fact, the state, reached a settlement with the advocates for the disabled, and they have, sort of miraculously managed to figure out a way to put this benefit into managed care Medi-Cal plans. So sort of reconstituting the program, if you will. And I wonder if we're going to see more of this, if we're going to see these sort of cuts go through, and then you'll actually have lawsuits where the state is violating federal law, or in some cases even state law.
I think we've seen, Sarah, we have seen so many lawsuits over the budget over the last few years. Lawmakers make a particular plan, somebody goes to court, it's declared illegal, we roll it back, and they keep coming back with some other way. And so, yeah, I mean, we've got, even in these trigger cuts that could happen, these cuts of a couple of $2 billion. We've been talking about education, but let's talk about social programs. Developmental disabilities would be cut by $100 million. In-home supportive services would supposedly be cut by $100 million, but already we're hearing that a lawsuit would be challenging that $100 million cut. And I think this goes to show that the options for lawmakers are narrower and narrower, based on not only popular opinion, but the courts.
So where does this end? I mean, is it just a continual cut upon cut? The people who don't want to raise revenue, what do they say about where this can all, where do they see the end game?
So far, all that we know, and the legislature's out of session, so we're going to really hear more of this in January. But really what we're hearing from people who don't want to raise taxes, that's usually Republicans here in the State House, are saying this is all the money we've got, and we're going to have to make do, and we're going to have to be more efficient, and we're going to have to cut funding in other places. And that is this ongoing huge debate that we've had for several years about, do we just take the money we have, or do we find a way to grow that pot? We did get some more data today. Unemployment's going down in California, so people think the economy is slowly stabilizing or slightly getting better. But tax revenues are what they are, and so I think we continue this debate into an election year, which will be very interesting, about what the size and scope of government should be. Well,
money again is at the top of the list, even though the actions with the U.S. Supreme Court, and it has, of course, to do with health care, which if the court makes a decision that requires more money. John, you're saying there is no more money? Sarah, has anybody considered that?
Sure. I think there's a lot of people in California who are really nervous about this. So as you said, the U.S. Supreme Court has agreed to hear this monumental challenge against the signature health care bill. At issue, of course, is this question of whether or not the government can mandate whether or not we buy health insurance. And there's a lot of speculation about sort of how narrowly the court may or may not rule. In California, I can tell you that we have plowed ahead with the implementation of this law. California was the first state to pass legislation to set up the insurance exchange. This is a sort of online superstore where in 2014, individuals who are currently uninsured or small employers who currently can't get insurance can go and compare apples to apples and purchase plans. And for those individuals who are of low and moderate income, who currently don't qualify for Medicaid or Medi-Cal in California, they'll be able to qualify for government subsidies up until about 400% of the federal poverty level, which is about $88,000 a year for a family of four. So in 2014, the state is essentially building the scaffolding to be ready for 2014. And I think nobody at this point who's in that planning process is willing to consider what happens if the government subsidies, the federal subsidies go away, because clearly it's not sustainable then at that point.
So what happens, how will life change in terms of insurance for people who are employed, for people who aren't employed? Who does it impact the most in California?
Sure. For the people the people that it impacts the most are sort of two main groups. One are the so-called childless adults who have poor childless adults who have so far been excluded from Medicaid. So a lot of people think that, well, if you're poor, you get health insurance, and that's actually not the case. You have to be disabled, you have to have dependents in the household, you have to be pregnant, you have to be a child. So a lot of people who are very poor, I mean, you're talking about people earning $10,000 a year, just because they don't have a child in the home, they don't actually qualify for Medicaid. So in 2014, that Medicaid exemption goes away. So all of a sudden, we now have millions and millions of more people who will qualify for the Medicaid program. So that's the first bucket. The second bucket are people who are uninsured right now because of pre-existing conditions or they can't afford a policy. So these are people who maybe earn $40,000, $50,000, $60,000 a year, or certainly all the way on up. But for that group, they'll be able to then go to this insurance exchange. Insurance companies will not be able to deny them a plan because of their pre-existing condition. They can't charge them more because they're sicker. They can't charge them more if they're a woman, which they used to be able to do. And so a consumer will be able to go to this insurance exchange and essentially sort of compare across plans and decide which one is best for them.
I hear
Sarah,
nothing but dollar sign, more money needed.
Sure.
To
I
fill in
mean,
the gap.
well, you know, when this bill was passed, the federal health law was passed, it was, there are massive projections in terms of savings from the Medicare program, specifically Medicare. And I think nobody, you know, this was really a sort of a health insurance expansion bill. This was not a cost control bill for sure. And that's exactly the approach they took in Massachusetts as well. They said, you know, we got to get everybody in first. We can start to sort of put, you know, tweak with some levers here and there to start to try and bring costs down, which we can talk about if you're interested. But then once we sort of get everybody in, then we really need to figure out sort of, okay, how do we bring costs down? Because we know that the cost curve right now is unsustainable in the United States.
John, I interrupted
And Sarah,
you there.
Oh, no, it's fine. Actually, this is actually a good point I wanted to ask Sarah. When we talk about costs, can you talk a little bit, if the federal law is upheld, which of course is a big if, the cost impact to the state versus the feds? Because it feels like what I hear a lot is that there's concerns that we get shoved with extra costs that we can't afford.
Well, I guess it's going to depend on how the court rules. So if the court leaves in place, say, the Medicaid expansion, which there's no real reason to think that they would dismantle that, presumably the federal government will still have to provide the match for the Medicaid program as they do now. So yes, I mean, in the long term, although let me say that in the first few years of the Medicaid expansion, the way the federal law is written, the federal government picks up the tab 100%. So it kind of it's supposed to give the states breathing room until 2017, 2018, 2019, it gets phased in when the state ultimately has to take over its share of that program.
So the Supreme Court will have a decision mid-year. When it's expected?
Around June, I think, is when they expect. I think they're supposed to hear arguments in March and have a decision sometime in June. So, of course, just in time for the presidential election.
Thank you all very much. When you really look at it, money is at the center of almost every story we've talked about tonight. Thank you all for being with me.